Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking inside the medial compartment here. This is the inside of the knee. You can see we've got an instrument in here that spins around. It's a shaver, and it's got suction attached to it. Right now we're just using it to irrigate the knee, running a bunch of salt water through the knee to help clean it up and give us a good picture. We can see you've got some thinning of the cartilage on the tibial plateau here. And if we look up at the femoral condyle, we can see something very similar here. And now as we look back here, we're going to look at the meniscus, of course, which is the kind of the white structure underneath the shaver there. Once we have this cleaned up enough, table down just a little bit, please. Once you have it cleaned up enough, we'll take a probe. Great. But again, here we can see some of the areas where the cartilage is a bit soft. Nothing loose yet, though. Okay, so we're looking in the lateral compartment. We're going to come back to the medial. My bad. And what we can see here is you've got what we call a discoid meniscus, because what we're looking at here is actually not the tibial plateau, but the meniscus. And I can show you that. Well, I can use that. I'm just going to use this as a probe since I have it in my hand here. But as you look here, see the tibial plateau is underneath here. Now this meniscus isn't torn, so that's good. But it's definitely a discoid meniscus. We can see it's attached around the periphery here and anteriorly. And it's not attached here. There's nothing really for it to attach to up here medially. So you have a discoid lateral meniscus, okay? Sometimes these tear, sometimes they look like this, or they're not torn. So at this point, we're going to certainly leave that alone. It almost looks like a little bit of a trampoline, doesn't it? We're going to leave that alone. The articular surface of the femoral condyle up above looks good. That's the popliteus tendon back there. And so I think we can leave this alone. We're going to look at the patellofemoral joint before we go back to the medial side. Okay, so now we're looking at the patellofemoral joint. And you've got a little bit of chondrosis here. Not bad. You had more on the medial femoral condyle and the medial tibial plateau, but you've got a little bit here at the top of the screen. As we follow the trochlea down, that actually looks pretty good going all the way down into there. So this is just part of the normal fat pad. We're just going to take a little bit just so we can see. There's a little bit of an area there. Okay, so by and large, the patellofemoral joint looks pretty good. So now we're going to go back and get to work on the medial side now that we've seen the whole knee. Okay, so we're looking here. This is the meniscus on the medial side. This looks good all through here. We've probed it. And as we look under here, I'm not seeing, there's no disruption until we get to the root back here. And like we talked about, you don't want to repair, but I'm concerned enough about that you can see here how I displace it. See that? And so I do feel like we need to do something, even though I may rehab you quicker than a typical repair at this point, which means putting a suture back here and then putting a suture here and allowing that to hold and hopefully even getting that to heal right there. So we'll show you how we do that in a minute. Okay, so now we're just placing in this, it's called a Super Bowl. Hold the camera real tight, 2 hands. And I'm just going to push this down until we reach the limit, our depth limiter. And that looks pretty good there. And so now we'll go ahead and deploy deploy the first implant, and then we'll just back out. And now we're going to look at placing our second implant in a vertical fashion right about here. And again, we're going to take it all the way down to the depth gauge here. Yeah. Can I spin it now? Okay, that looks down there. I'm going to pull the trigger again. And now with the same trigger, you can cycle it. Okay, so you can see here, we're going to go ahead and cut the retention suture here. That looks good. And now what you can see here is we've placed it's a meniscal tape. I believe it's the only meniscal tape for repair. And you can see how that's holding down that posterior edge of the meniscus. And hopefully we'll give all of this a chance to recover and be stable for you. Okay. Now, the rest of the meniscus position looks good. I'm happy with that. Happy with that repair. I don't really want to put another one in because I don't want to place too big of a hole in the meniscus. So we're going to finish up there. I may make a few little vascular channels in the capsular junction, but otherwise we're done with the video. Okay, so good luck to you now. Bye-bye.